Step 1 is to determine your enrollment period. For those of you who are just turning 65, you have what's called the initial enrollment period. This starts 3 months before you turn 65, includes the month of your 65th birthday, and ends 3 months after you turn 65. For the vast majority of you who are watching this or who are following these steps, this is probably the enrollment period you're going to fall under. Next is the general enrollment period. This is if you missed your initial enrollment period, you can enroll between January 1st and March 31st of each year in Medicare Parts A and B. So this is general enrollment period from January 1st to March 31st of every year. Then there is a special enrollment period. These can vary from state to state, from person to person. If you have specific circumstances such as losing employer health coverage, you recently moved, or you've suffered a natural disaster that delayed your ability to enroll, you might qualify for a special enrollment period. If this is you, if you were recently in Florida and it was your initial enrollment period, but due to the hurricanes that Florida has been undergoing, you have had a delay due to cleanup and just recovering, you could qualify for what's called a special enrollment period. In fact, you likely do. Next, step 2 is gather necessary documents. So the necessary documents you're gonna need to have are your social security number, a birth certificate or passport to verify your age, any current health insurance information including policy numbers, as well as proof of residence such as utility bill or a driver's license. Step 3 is decide on your Medicare coverage. Understand original Medicare Parts A and B only cover 80% of your medical costs. You must have a secondary to cover the additional 20%. Now, to cover that additional 20%, you can choose between a Medicare supplement plan, also known as a Medigap policy, or you can choose a Medicare Advantage plan, also known as Part C. If you go the supplemental route, you will need a Medicare Part D prescription drug plan as well. Step 4 is to enroll in Medicare. Now, to enroll in Medicare, you just need to go to medicare.gov and use the Apply for Medicare tool to enroll online. If you're not very good online, you can alternatively call Social Security at 1-800-772-1213. You can apply over the phone. So if you just happen to be coming across this video on the internet without being in my email list, just call 1-800-772-1213 if you're not very good with websites. But if you do want to get into my email list where you can get more additional information and resources like this, check in the description below. There's also a step-by-step guide that you will get in addition to this video. Just watching the video and you don't have the step-by-step guide, check the link in the description below to get your free downloadable version of the step-by-step checklist to follow. Step 5 is review your prescription drug plans. Whether you're going the supplemental route and adding a prescription drug plan on top of that, or you're going the Medicare Advantage route, it is important to go to medicare.gov and compare drug plans. Basically, what you need to do is make a list of your current medications, the dosage amount, and how often you get them filled to check plan coverage and costs. When you go to the tool on medicare.gov, you enter in these 3 pieces of information, enter in your entire list of drugs, and then when you click next, it will give you a list of either prescription drug plans with all the costs of your prescription drugs or Medicare Advantage plans with all the costs of your prescription drugs. And it will even order them in the order that will have the least amount of cost to you. This is an awesome tool to use, and I highly recommend that you do it before signing up for any plan. Step number 6 is choose or update your healthcare provider. So ensure your preferred doctors and hospitals accept the Medicare plan that you've selected. Oftentimes, you can double check with the provider itself to see if your preferred doctor, hospitals, specialists are in network. Other times it's more efficient just to give your doctor or your healthcare provider a call and ask them if they take X company. Step number 7 in the checklist is to keep track of important dates. Annual enrollment period is every year between October 15th and December 7th. During this period, you make as many changes as you need to make to your Medicare Advantage plan, your prescription drug plan, and then the last change that you've made at the end of December 7th is the change that will go into effect on January 1st. Next is open enrollment period. This is from January 1st to March 31st. During this period, you're allowed to make one change to your Medicare Advantage plan or prescription drug plan, and this is for just in case you made a change during annual enrollment period that isn't working out for you in the first quarter of the year. So you have the entire first quarter of the year to make at least one additional change if for some reason the changes that you made in annual enrollment period are not working out. The next enrollment period you need to know about when you turn 65 is Medigap open enrollment. This is when you turn 65 and you put Part B in place, you have up to 6 months to enroll in a Medigap plan without having to health qualify for it. you are guaranteed to be issued a plan when you first turn 65. If you decide later on you want to go to the supplemental route or the Medigap route, you will need to health qualify, and that can be more difficult if you have certain health conditions going on. So if you do have a lot of health issues and you can afford to go the Medigap route or the supplemental route, when you turn 65 is the time to put it in place. It is important to note that if you start with a Medigap plan and later on you decide you want to try an Advantage plan, you have 1 full year to try an Advantage plan. If it's for some reason isn't working out, you are automatically guaranteed to get back in the original Medigap plan that you had. So it's another thing to consider and keep in mind. Or step 8 of the checklist is understanding your out-of-pocket costs. So when you are reviewing different plans, you want to make sure you review your monthly premiums, your deductibles, your co-payments, your co-insurances for each part of Medicare. This includes your Part B premiums for Medicare, your monthly premiums for a supplemental plan, your monthly premiums for a prescription drug plan. If you decide to add dental, vision, and hearing as well, you'll have a premium for that. That's all on the supplemental side. If you go the Medicare Advantage side, you want to know all of your co-pays and your maximum out-of-pocket. So co-pays to see your doctor, co-pays to see your specialist. Whatever the case is, you need to make sure you review the summary of benefits and know all of your out-of-pocket costs so you know what to expect and know what your maximum out-of-pocket will be. Some of these plans are now including health deductibles and drug deductibles. So it's really important to take everything into account to make the best decision for you. Step number 9 in our Medicare checklist is to set up your online Medicare account. Create a medicare.gov account to manage your benefits, track claims, and access Medicare resources. This is just something that's good to do, good resource to have, and a place where you can access more information on Medicare. And finally, save all the important information such as the number to Medicare, which is 1-800-MEDICARE or 1-800-633-4227. The number to Social Security, that's 1-800-772-1213. Feel free to sign up for the email list down below to get the free download and my contact information. I'm currently licensed in the state of Colorado and Florida, but I'm happy to get licensed in whatever state you're in and help you out as well. My name is Mark Anthony. This is Right Hand Retirement, and I look forward to helping you on your Medicare journey.